Hi guys, welcome back. Today we're going to talk about the malaria vaccine that's finally rolling out this year. We're going to talk about what malaria is, some really interesting history of malaria, where we are now, and where we're headed. If you're enjoying these videos and you want to stay up to date on global health news and public health news, please remember to subscribe to my channel. Thanks guys. So for the last 20 years, scientists have been working really hard on developing a vaccine to fight against malaria. And we finally have one. It's called the RTS vaccine, and it starts rolling out in Africa this year, 2022. So it's such a big deal, right? Why aren't we hearing more news about it? Is it all it's cracked up to be? We're going to talk about that in a little bit. But for now, let's talk about what malaria is. Malaria is actually a parasite, and it's transmitted through the bite of the female Anopheles mosquito. In order to infect people, malaria has to go through a life cycle. Here's a picture real quick. I'm going to make this super simple. Basically, a mosquito bites a person. The parasites, P. falciparum, goes into the bloodstream, goes directly to the liver, which is where it hides out and it multiplies. Eventually, it multiplies so much that those cells burst, and the parasite is released into the bloodstream, and that's where it infects the host. Once it's in the bloodstream, other mosquitoes can bite this person, carry the parasite, and transfer them to another host, which is another person. Just some quick facts real quick about how huge the malaria problem is globally. In 2020, there were 241 million cases of malaria throughout the world. This caused an estimated number of deaths of 627,000 people. 95% of those cases of malaria are in Africa, and 80% of the cases of malaria globally, and especially in Africa, is children under 5. This is huge. This is a disease that is causing high rates of death in children in Africa. It's having an effect on every facet of the development of many of the countries in Africa, and just causing widespread devastation and human loss and suffering. In 2021, the United States spent $979 million on global malaria control efforts. Now, why would we do this, right? Malaria is not endemic in the United States anymore. We don't see cases of malaria here. So why do we have such interest in the United States beyond diplomacy and humanitarian efforts? Well, malaria can destabilize a country, and we're going to get into that when we talk about the history of malaria in a few minutes. But we have a vested interest in preventing conflict throughout the world. And when something as large as malaria is sweeping through an area and destabilizing entire countries, we want to ensure that that destabilization doesn't turn into conflict, and we don't see more wars, more military coups like we saw this weekend in Burkina Faso. And so even just outside our interest in relieving human suffering, we're also interested in preventing conflict. Despite all of our efforts on prevention of malaria, since 2000, malaria cases and deaths have been rising, especially in Africa. And then especially in the last 2 years, and we don't have all the complete data for this yet, but due to the COVID-19 pandemic, malaria cases have risen exponentially, especially in areas of Africa. So real quick, I just want to go over some interesting history of malaria. Thousands of years ago, malaria was endemic over half of the entire globe. Many preventive measures and some chemoprophylaxis has lessened the burden of malaria in many areas, including the United States, and even some genetic mutations. So I'm sure you've heard of sickle cell disease. That's actually a genetic mutation to disallow the P. falciparum parasite from entering the host blood cells. Now, sickle cell disease still persists today, and it is a very painful and devastating condition. However, that was a way in which the human body evolved to try to beat malaria. Another historical fact about malaria is that malaria actually helped the barbarians take down the Empire of Rome. And what happened was there were so many malaria epidemics in Rome that agriculture really fell off, and they weren't able to eat nutritious food and be healthy. And many of the soldiers were sick and many of the people were sick. And that just weakened the entire Empire of Rome and allowed the barbarians to come in and take over Rome. Finally, this is really interesting. One of the earliest known treatments for malaria, or preventive treatments for malaria, was something called quinine. And what you had to do was add quinine to a liquid and drink it. However, the amount of quinine that had to be added to a fluid in order for it to actually work made it taste pretty terrible and bitter. So British officers started adding sugar and gin to the quinine solution, and that brings us today's modern gin and tonic. So next time you have a gin and tonic, realize that you're drinking that drink because British officers invented it to try to prevent malaria. And that's all pretty interesting. Many people don't realize that malaria used to be endemic in the United States. So I just wanted to show you a map real quick from the 1870 census of the United States that shows how widespread malaria was in the United States in 1870s. Now, basically development allowed us to move indoors and not be sleeping outside at night where the Anopheles mosquito actually bites. And so basically moving inside and having a developed nation is what allowed the United States to conquer malaria. So prior to this vaccine, what have we been doing to combat malaria? As someone who spent most of my life working in malaria endemic regions of the world, I did spend a lot of time working on malaria prevention programs, and they are extremely difficult programs to put in place. So some of the things that we were doing is vector control, which is basically the mosquito is the vector that carries the disease, and anything that prevents the mosquito from biting a human is vector control. So that includes spraying of pesticides and bed nets and having people sleep indoors and things of that measure. We also use preventive chemotherapies, which is just a fancy way of saying we give and we take medicine that prevents the parasite from completing its life cycle inside of the human. So something like doxycycline, which is something that I took for decades working in Africa and Afghanistan. But as a result of so many of these chemoprophylaxis, such as doxycycline, we are seeing resistance to these anti-malarial drugs. And so that is a big problem that's starting to really come up now in most of these malaria endemic regions. And so this is really good timing of this vaccine rollout. So now we have this vaccine, and it's called the RTS-S vaccine. And I'm sure a few people are thinking, why did it take so long to make this vaccine? Like, we made a COVID vaccine in months, so why so long for malaria? Well, the answer is that malaria is a parasite. It's not a virus, it's not a bacteria, it's a living organism just like we are. And so to develop a medicine or a vaccine that attacks a living organism as ourselves is extremely difficult to try to target that without causing harm to the human host. As soon as the parasite from malaria enters the human body, it goes straight to the liver and it just hides out. And it basically disappears and replicates itself inside the cells of our liver. So anything that's targeted to treat the malaria or beat the malaria inside of the liver has a really high potential for harming our liver. So it was really difficult to develop something that didn't harm us, but did harm another living cell. So what does this vaccine do? It interrupts the parasite life cycle as soon as it enters the human. So in that short little frame of time from when the mosquito bites the human and the parasite enters the liver, and that's where it attacks the malaria parasite. The development of this vaccine is actually a pretty interesting story. So it was developed and then it was trialed on US military members. So you're welcome. I actually was not part of the trial, even though I would have been, because I was so sick of taking doxycycline every day, which has its own host of side effects. So it was trialed on the US military in Africa, which is also where I worked with the military. And then once it was through the phase 1 trials, it was picked up by a British pharmaceutical company. And that British pharmaceutical company actually conducted the phase 2 and phase 3 trials in Africa with African scientists. So this is like a true global health success story. It was trialed by doctors in the region that it was meant to affect. So that's pretty neat. It's now through phase 2 and phase 3 clinical trials, and it's ready for rollout, and they're rolling it out between 2022 and 2025. So that leads us to the question of, why isn't this bigger news? Why are we not just seeing this like amazing ticker tape parade that we have this vaccine that's going to defeat malaria in Africa? Well, the truth is, as great as this vaccine is, there are some issues with it. It is not as highly effective as we would like it to be. Basically, it's going to prevent maybe 1 in every 200 deaths of children under 5, which is something, you know, that's more than we were preventing before the vaccine, but it's not as high of numbers as we would like to see. Additionally, there are some implementation issues, and for anyone who's worked in global health, we all know that access to care is a huge issue, especially in Africa. So for this vaccine, the vaccine's being rolled out for children from 7 months to 20 months, and it takes a 3-shot series for this vaccine. So it can be difficult for families to get their children to a clinic to get this vaccine 3 times in a row. That's a lot to ask of anybody in the United States with a car, never mind people who are living in these rural communities in Africa who are walking miles to days to get to clinics. So that's going to be a little tough to implement. On top of that, it does take an additional booster 20 months after the 3rd shot. So they'd have to get back an additional 4th time for the booster for the vaccine to have any kind of long-term effectiveness. The effectiveness of the vaccine does wane over time. However, it should be enough to carry children to close to the age of 5 if they do get all 3 shots in the series, and then the booster 20 months after the 3rd shot. So it is good news. It is something, and it's going to lead to the development of more vaccines, and perhaps the development of vaccines that can help other parasitic infections, such as schistosomiasis, which is another parasitic disease that is wreaking havoc in these areas. So it's good news. We're getting there. We've developed something. We finally have some malaria vaccine to put out there and help this cause. However, it's not the be-all, end-all of we've finally defeated malaria, but it's a step in the right direction, and it makes me very hopeful, and it should make you very hopeful too. All right, guys, thanks for joining me today to learn a little bit about malaria and this new vaccine that's rolling out in 2022. Don't forget to like this video and subscribe. Check out the links to all of the articles that I use to inform this video below in the bio, and have a happy and healthy day. I'll see you guys soon.